Hi, I want to raise awareness for a serious health condition that frequently gets often misdiagnosed, and it's actually a deadly disease. Um, it's called CTEPH, CTEPH, or if you want the full term, chronic thromboembolic pulmonary hypertension. Now, what this means is you have blood clots in your lungs. Usually, if someone has a blood clot in their lung or blood clots, the body reabsorbs the clot and redistributes it, breaks it down, redistributes it. For a small number of people, the body, for some reason, does not break down the clot, and therefore it ends up staying lodged in the lung. Now, over time, what happens is these clots get bigger and bigger, and they eventually become scar tissue in your lungs. And then what happens then is blood can't get through past this scar tissue in whatever branches of your lungs it's blocking. And so what that does is it backs up the blood pressure back to the right-hand side of the heart, which causes the heart to enlarge. So it's the right-hand side of the heart to enlarge, and also puts pressure on your heart. And then what that in turn means is you end up struggling to do everyday things because you can't breathe, because there's not enough blood, oxygenated blood getting through your lungs, and it's coming back. For me, my condition, as an example of how bad it is, I used to play rugby and football. I used to play five-a-side football in a league 3 times a week. And I used to train at rugby twice a week and play on a Saturday. So 6 days out of 7, I was very active. And I could run all day. I could, it was brilliant. I loved it. Now, because I suffer from this condition, I have gone from being able to do that 6 times a week to hardly being able to walk 20 metres at a steady pace without having to stop to get my breath. Life, since I was diagnosed and since I've suffered with this condition, has been non-existent. I struggle with everyday things now. I can hardly bend down to put a pair of shoes or a pair of socks on. I can't carry shopping from the car to the house. I can't lift anything heavy. I've practically become a recluse because I can hardly go out anywhere unless we go out in the car. I can't walk anywhere because it's not painful. It's just the breathing side of things is just horrible. You're struggling for oxygen like every few minutes if you're walking. That's my because I'm class 4, so I'm like one of the highest. I'm in one of the highest risk categories. Excuse me. Basically what this in turn happens then is because of the back pressure from your lungs to your heart, eventually, over time, it puts too much pressure on your heart to the extent where your heart will eventually stop because it just can't cope with it. Now, my prognosis, I'm due for an operation to fix this, which is taking place exactly a week from today. So the prognosis without this operation for myself, and I believe for most people who suffer this condition, is 5 years maximum. Because your heart just won't take it anymore. Eventually, the pressure will be too much and it will just stop. So now moving on to the procedure. I can't remember which one it is. There's only 5 or 7 places, or should I say hospitals, medical centres, whatever, that perform this procedure in the entire world. Luckily, being in the UK, we have a fantastic site down in Cambridge called Royal Papworth, and we have who is regarded as the best in the world at the procedure in Dr. David Jenkins. So I'm due to have this in a week. Now let me explain the procedure. It's classed as open heart surgery. So obviously they put you under. They obviously then cut you open for your chest bone. Then what's required is your body, your heart and lungs are put on a heart and lung bypass machine. So what they can do then, once that's sorted, they get to the clots that they can reach in your lungs. They cut into the pulmonary artery, and then they go in and they cut the clots out that are easy to get to, which are the ones that are pretty much central to the chest. After that, what happens then is the further into the branches, if you like, in your lungs, the clots are. Eventually, what they need to do is they need to drain your entire body of all your blood and put it through the heart and lung bypass machine. They need to stop your heart, and they need to bring your body temperature down to 20 degrees Celsius. Now, the reason for this being is the fact that the brain can survive longer in colder temperatures, which therefore gives them a time frame in which they can perform the procedure. Initially, it is 20 minutes. So basically, once your body's cooled down to 20 degrees Celsius, they have a 20-minute time frame to go into one lung and cut out whatever clots are further down into the branches, before they have to stitch that up and reperfuse your body to get oxygen back to your brain. They have to do this on both lungs, obviously. So they'll bring it. I don't know if they bring your temperature back up or if they keep it 20. I think they bring it back up, or if it's a case of reperfusion. I can't remember. I've not read that bit on it. And obviously, then again, they've got to cool you down against 20 degrees and go into your other lung, draining all your body of all your blood in through the heart and lung bypass machine, and cut out the remaining clots in the other lung. And then obviously, all being well, they've done the procedure, stitch you back up, all the tubes removed from your heart, things like that, stitched back up, you're brought back round. Now, the procedure itself, not the procedure, but the whole entire operation takes 8 to 10 hours, which is quite a long time, as you can imagine. But the actual procedure itself, where they actually start the surgical bit of it, should I say, the operating bit, it's only at 40 to 60 minutes. All the rest is like putting you under, bringing your body down, draining all your blood, putting all the tubes into your heart to drain it, and the rest, basically. So it's all the messy bits, if you like. So yeah, as you can imagine, it's a pretty big procedure. This operation has 95 to 96% success rate. I'm a member of the CTEPH group on Facebook, and I know quite a number of people that have had even 20 years ago they had the procedure done. So obviously, it's been it's been a main procedure. It's been around for a while, and to think that they could even do this 20 years ago is just unbelievable, given the fact that what the technology is like then to compare to what the technology is like now. So yeah, the reason for my video, like I said, is to raise awareness, because often this condition has been misdiagnosed as a chest infection, asthma, COPD, and it's much, much more serious than that, to the extent that it is actually life-threatening. It's your life. It's basically, if you have it and you're misdiagnosed with it, and nothing's done in that time, it is fatal. It's no question about it. It will kill you. So yeah, there's not enough awareness of this. Now, once you find out about it, there's an amazing group on Facebook called UK CTEPH, and it is absolutely full of absolutely brilliant people that give help, support, who have had the procedure. They suffered themselves with it. It's not just somebody giving advice that's not had it. It's full of people that have actually suffered from the condition, had the procedure, had the operation, and it's really good. But without this, without knowing about it, without being diagnosed with it, if you do have it, it's a very unknown disease. Well, I say it's a disease. It's not a disease. It's condition. It's unbelievable. I only found out about this back in September, and that was after I had to push my hematologist to because I knew there was something wrong with my lungs. It didn't feel right. I was on medication, and it just did not feel right, and it just got worse and worse, my breathing. And I had to push for them for me to see a specialist. I had to push them to see a specialist. This is where my problem lies. Why, as a patient, when you know something is wrong and you don't have any medical experience, you don't have any machinery, any tests or anything that you can do yourself to test for this, why, as a patient, do you have to push professionals who have all these things at their disposal to have these tests and find out? This is my issue, and it's wrong. It is completely wrong. I had countless CT scans, X-rays, blood tests, you name it, and I still had to push to see a specialist, a lung specialist, despite the fact the CT scans and the X-rays would have shown the clots in my lungs. And I just find that unacceptable. Yes, I understand the NHS are understrained, they're understaffed, they're underpaid, they're overworked. I understand that. But if you're in a profession like that and your duty of care is to look after patients, to look out for their well-being, and you have the tools at your disposal to diagnose conditions or to look for these things, and you still do not do it, and you have chosen that profession, is not good enough. It really is not good enough. And if it hadn't have been for me pushing, if it hadn't have been for me telling them that there is something wrong, I need to see a specialist, I need somebody to do these tests, then I would not have known this condition. I would be struggling. Well, I'm struggling anyway now as it is, but it would have got worse and worse and worse. And in the end, it would have killed me. And for anybody's money, that is inexcusable. That is completely inexcusable. Even when she said, "So do you want to see the lung specialist in Sheffield?" Even then, she said, "Will you turn up for your appointment? Are you sure you'll turn up for your appointment if I were to?" I'm sorry, but I pushed, I asked for this. But no, I'm not gonna turn up. You do know what I mean? It's just, you cannot excuse that. Because even when she eventually got round to referring me to a specialist, she was still questioning whether I would turn up when it's me that requested it, whether I would go to the appointment just because it's in Sheffield and I live in Leeds. It's just I will keep on saying it. It's inexcusable. I'm not saying all doctors like. I have had issues with this particular hematologist over the years. Let me tell you, to the extent where whenever I've been in hospital and they've had to involve her, or I've refused to want her to have anything to do with my treatment on 2 or 3 occasions now. I will not have her deal with my medication, with my treatment. It's that bad that I was in hospital 6 months ago. I was coughing up a lot of blood. And I'm under the care of Sheffield, Royal Hallamshire, the lung specialists there. So I was in November and twice in December with episodes of coughing up blood. The second one was the worst because I actually coughed up about a pint of blood, not in one go, but just continuously coughing. And they had to perform a procedure to because I found the bleed in my blood vessels in my lungs, so they had to perform a procedure to block that off. But even then, I was in there once in November, twice in December. St James's Hospital. I don't mind. I'll name and shame. And I was involved with Sheffield. They were my lung specialists. So, with my experience with the NHS in Leeds, especially St James's Hospital, it's not been the best. And they were taking their time. They were dragging their feet as to what to do with me at St James's. So I rang my specialist while I was hospitalised at St James's Hospital, explained the situation to him. He immediately came off the phone, and I'd been asking for about 2 days, what's going on. They couldn't give me an answer. As soon as I came off the phone from my specialist in Sheffield, he got on the phone to St James's, basically to ask them what the hell is going on. And I'm not joking you, within 5 or 10 minutes of my phone call to St James, to my specialist in Sheffield, a consultant came into the room to say what was going to happen, to say the way forward. Now, for me, that is inexcusable. Why did it take a phone call from me to my specialist to get St James's Hospital to get their fingers out their backsides and find out what they were doing with me? That is inexcusable as well. The doctor, the haematologist dealing with me in that sense, the same one that I had to beg to see a lung specialist. I'm on blood thinners, and I was on what's called rivaroxaban, 20 milligrams. So when I had these episodes of coughing up blood, especially, was it the second time round, I think it was. The plan was, this was the plan, right? To just stop the blood thinners, just so my blood could thicken up a bit to seal off, to try and stop this coughing up blood. After that, after being taken off that for two days or so, the plan going forward, this is what I was told. Well, I wasn't told anything, actually. What happened was, Dr. Horn came in one morning, said, right, it stops, blah, blah, blah. We're going to put you back on 20 milligrams of rivaroxaban. So I was like, right, okay. I'd had enough of her at this point. Didn't like her. Thought, right, okay, I'm going home. So I walked out. So I rang up the ward and spoke to the registrar. Not the haematologist that was dealing with me. I rang up the registrar and I explained the situation to her. I said, this is what's gone on. I said, what is the plan? Because I've been put back on 20 milligrams of rivaroxaban. And she was like, who did that? So I told her. She was like, no. The plan was to restart you on 10 milligrams and monitor you on that. And if you did okay on that, to then put it up to 20 milligrams. So I had a haematologist restart medication at 20 milligrams when the plan was to start me on 10 to see how I went, to monitor me on 10 milligrams, and then if it was possible, to up it to 20 milligrams. And yet I had a consultant, a doctor, whatever you want to call her, because I don't know where she got her bloody qualifications, start me immediately on 20 milligrams, despite the fact I was supposed to start on 10 and be monitored. Now, I've complained about this doctor to pals, and all I get from pals, it was a miscommunication. It was a miscommunication. So I'm sorry, but you're talking about people's lives here, and you're just fobbing it off as a miscommunication. How can you possibly use that as a defense to basically putting somebody's life at risk, to messing up their medication, a miscommunication? She is a professional. She is a hematologist. She should have known the plan. They're supposed to have MDT meetings every morning. So it would have been discussed that morning as to what the plan was regarding me, and yet she still messed it up. Not just messed it up, but the fact is, she should know as a leading, not just as a junior, not as a shadow. She was a leading hematologist. She was the top hematologist. Well, I say top, I mean as in rank. I don't mean as in the best. So, yet she still botched it. And this has been going on for nearly a year now. So, here is my thing. Like I said, I want to raise awareness for CTEPH. I want it to be where people do not have to push. Patients do not have to try and diagnose themselves and then explain their reasons for it to a professional, to get the treatment they need, to get the diagnosis they need. It's not on. It is not on one single bit. So my main point is raising awareness of CTEPH. And if you get told, if you know something's wrong with you, forget it. You tell them. You don't wait for them to decide. Don't take their word for it. At all. Do not. You know your body. You don't need all this fancy equipment, you do not need all that to know that your body is telling you something. That something is wrong. And even if they say it's this, you will know it's not. You will know it's more than that. So that is the reason for sharing this video, to raise awareness of it, to get people, to patients, people who are probably suffering with this condition right now that don't even know about it, get checked out and pushed for it. Because it's not just an infection, it's not just the flu or a cold, or it's your life. It is life-threatening if you do not get the right treatment. It is fatal. That is my point. If you do not get the right treatment, if you suffer from this condition and you do not know about it, but you know something's wrong, and you do not get the right tests, the right care, it will kill you. There's no two ways about it. There's not a percentage of people. Everyone who has this condition and is not diagnosed with it and is not treated for it will die. So please, get the treatment. Get pushed for it if you know something is wrong. Seriously. Let's raise awareness. I want to raise awareness of this because it's not unheard of. It's not heard of in the general community, within people. But yeah, the moment you get diagnosed and you research it, there is so much information on the internet regarding this condition. So much information, but yet it's not in the public eye. The condition, hardly anybody knows about it unless they actually suffer for about it. Once you find out what it is and you type it into Google, the amount of information that comes up is unbelievable. It is absolutely unbelievable. So the research has been done on it. All the documents, all whatever has been published on it, all the findings and the facts and everything, and there's a ton of information out there. But yet, there's no awareness for it. And I'm not being funny. Look at this. I'm not racist, but look at this Black Lives Matter movement. We know racism has been in our society for years and years and years and years. We know that. And then all of a sudden, because we have a pandemic and that what happened to George Floyd was absolutely unforgivable. You can't, I will say that. It was unforgivable. I'm glad that copper got sent down for it. I really am. So I'm not racist because I'm glad he got sent down for it. But why, when it's been in the spotlight for so many years, so many people, has there been so much emphasis on that this year? Despite the fact we already know racism exists. We already know it's rife in the community. But yet we have this condition like this that unless there's any awareness raised of it, nobody would know about it. Or hardly anybody. I can't fathom, I can't defend that. I can't defend that at all. We know racism has been rife for many, many years. We know it's been in our society. Ever since slavery in America and Hitler, we all know that. We know it. But yet, there's been so much emphasis on it this last year. And yet, this CTEPH, this chronic thromboembolic pulmonary hypertension, a life-threatening condition if it's not treated, if it's not tested for, and it's not diagnosed, has no awareness whatsoever. And I'm not being funny, I think that's more important. I think that is more important. It's more important because there's no awareness for it. There is awareness for racism, we know that. So why are we continuing to raise awareness of things we already know about instead of constantly like, what don't we know about? What else is going on that we don't know about that needs the light shone on so people can get the right information? That's my theory. It just does not make sense. The gay pride movement, I have friends that are gay. But come on, we've known about homosexuality, we've known about lesbians, we've known about bisexuals, transsexuals, transvestites for years and years. But yet it's there, it's on the telly all the time. There's a month of June that's dedicated to it. We already know about it. So why does it need to be completely and all the time in the media? When there's stuff like this, there's things, more important things like this, where there is no awareness. People are putting emphasis on the wrong things to be aware of. To be gay and proud. I have friends that are gay. So I'm not a homophobic. I have friends that are gay. One of my best mates is gay. I have a right laugh with him. He's honestly, we have a blast. But even he is like me. He's like, we don't need it thrown in our face. We already know it's there. Why is all this, why is all this awareness made of it? Raising awareness or celebrating it or whatever, when there's other things out there that are more serious, that need to be dealt with, that don't have a light shone on them, that people do not know about, and it needs knowing about. So please help me raise awareness for this condition and other conditions that probably aren't known about. There's probably a wealth of information out there about them. Please help me to raise awareness for this condition because it's serious. Please. Thank you.